comfortable here, and she's very well cared for, and I don't know that we would have found that anywhere else. Sometimes I think right now they know my mom better than I do.
No doubt part of your daily routine involves brushing your teeth at least twice during the day, perhaps even 3 times. But for those of you who are sending your kids off to school, want to make sure the sugary sweets get out of their teeth to avoid cavities, you are in luck this morning. Dr. Michael Hernandez is back with us. He has Chattanooga Dental Care. He's the dad of 2, right?
Yes.
Still just 2.
Yeah, 1 in school.
Since I saw you last. So you know quite well what it can be like for a parent of younger children to get their kids to brush their teeth the right way.
Yes, yeah, it can be a challenge. Studies say that kids aren't really adept at brushing their own teeth until about 7 or 8 years old, believe it or not. So if your child is wanting to brush their own teeth, that's great, and you can let them because that helps them learn. But until they're about 7 years old, probably a good idea to most of the time either brush them with them or go back after and make sure that they've done a good job. But all kids will be a little different.
I know there are a lot of, not gimmicks, but I'll use that word out there. So you go to the toothbrush aisle and it's endless what you can choose from. And sometimes you can, do you go with just your standard soft bristle, right? You want a soft bristle brush?
That's a good place to start, yeah. Soft bristle toothbrush. You don't want something that's going to be too abrasive and potentially harm your gums. But also electric toothbrushes are great.
That was going to be my question then.
Yes, yeah. Electric toothbrushes, they can help a little bit. If you are doing a really good job with a manual toothbrush, it can work as well as an electric toothbrush, but an electric toothbrush takes a little bit of the work out of it. It does some of the work for you, so it makes it kind of easier for people in general.
I'm thinking back to when my girls were little, and the length of time that you brush your teeth was a big push then.
Yes.
And it seems like you wanted to sing like the happy birthday song or something. Is that right?
Yeah, the happy
song
birthday
is great. So some toothbrushes had music that they played.
Yes.
Is that still on the market?
They do. They have those, or they have a little timer on them, but 2 minutes is what you want to shoot for when you're brushing your teeth. Try to aim for 2 minutes.
Okay, so your kids are out the door, they're away from you until you pick them back up at the end of the day, and you hope that they've eaten the apple that you packed in the lunchbox, but they might trade it for a cupcake that a friend brought, right? It can happen. So is it a good idea, I've heard, to chew on some gum or something to kind of cleanse the food out of your teeth?
Chewing on some sugar-free gum is not a bad idea. There are gums also that have xylitol, which is a sugar that makes it a little sweet, but can't cause cavities. If you're brushing your teeth in the morning and brushing your teeth at night and flossing at night, that should keep you pretty well covered. So we don't have to worry too much about what's going on at school, but if we can not have sugary snacks consistently, that would be a good idea. So
you said a word that got a lot of people going, yeah, right, and that's flossing. Statistically, how many of us floss?
The statistics, because it's self-reported, it's hard to really say.
Oh, we skew the numbers.
But the numbers might be a little skewed. But it's a good idea to floss. If you can floss, multiple times a week, ideally nightly, just along with your toothbrushing. It's hard to get a new habit started, but if you can floss at night right before you brush, that's going to be the best for your teeth.
Is there a difference in the old-fashioned, put it on either end of your finger and floss versus the little picks?
No, they work the same way. And sometimes those little picks are more convenient. They do create a little more trash in your trash bin, but the wrapper on the floss or the little plackers is one of the ones that are that system. They work great.
So it is, I've said it on the air before, and I always regret it when it comes out of my mouth, but I think it's true that people dread going to the dentist. I remember as a kid, I can still see going to the King Building in Atlanta to get my teeth cleaned, and it was the one time I would lock the car door to not have to get out. I was so scared to go to the dentist. So sedation dentistry has really increased in popularity.
Yes, sedation dentistry is something that we offer at our practice. Studies say that between 30 and 50% of people avoid going to the dentist because they have some anxiety or fear of the dentist. So if you come to our office, we have different levels of things that we offer. We can do nitrous oxide, which is known as laughing gas, which helps a lot of people, kind of just helps you relax a little bit. But if you're someone who needs a level above that, we do sedation for those patients. They can come in, we talk to them. We've got a very inviting atmosphere. Everyone at the office is very friendly. And then at that appointment, we'll just look at your teeth and talk, so nothing to be too concerned with at that appointment, and then we'll talk about bringing you back with sedation to take care of your dental needs.
It's funny how having a good smile has kind of become the primary, that and eyebrows. It's what all women want, I guess men too, when it comes to that instant look that you have.
Yeah.
So when you're getting your teeth whitened, if you want to do that professionally,
yes,
can you sort of customize it in a way so that if you want it to be as natural looking as possible, you can go that route, or it can just be glamorous?
Yes. So we don't offer the eyebrows yet in the office.
No, I knew
we'll
you
have
would.
to think about that. But the teeth whitening, we can do at-home whitening. So for people who don't want to stay in the office and have their teeth whitened, the quickest way to do it is in the office whitening. And there are different levels of whitening that we can go. We can get you whiter, or we can tone it down a little bit. It's a multi-step process. So we kind of stop and take a look and see what you think, and then we can go some more. Usually in about four phases would be the maximum that it would take. But
and if you're going to do that, if you're going to go that route and you're a coffee drinker, is it a good idea to sip the coffee through a straw as opposed to drinking it? Do you have to be careful?
You don't want to drink anything that would stain right after you bleach your teeth, because it can absorb that a little bit more, and it will kind of undo some of the bleaching that you do. But drinking with a straw is probably going to be too off-putting for most people. I would just say, drink your coffee if you'd like, and come to the dentist every 6 months, and we'll
So
clean.
you can live your life.
Live
in
your
other
life,
words.
yes. Yeah.
Okay. I've got a minute left.
Okay.
Anything else I should have touched on before I let you run? You have a new you have a new dentist.
We have a new dentist. Yes, Dr. Vandenberg. He's been with the practice for a year now, actually. There he is. And he's a great guy. We both are struggling to fill Dr. Major's big shoes. He was with the practice. He was the owner of the practice for several years, and he has since retired from dentistry. But I've been there for the last 4 years, so I know most of the patients. Dr. Vandenberg has gotten to know a lot of the patients, and he offers all the same dental treatments that myself and Dr. Major were offering. We do sedation dentistry, we do implant dentistry, cosmetic dentistry, and family dentistry. As part of our general dentistry there at the office.
Well, I'm glad to see you. It's been a while since we had a chance to talk. You're probably getting more sleep than you were last time. You had a brand new baby last time.
Yeah, we are. Just sleeping through the night now.
You can find Dr. Michael Hernandez and the entire team at Chattanooga Dental Care. They're on Shallowford Road, 499-9300. Online, it's ChattanoogaDentalCare.com. As he mentioned, it is family dentistry, which makes it so easy to schedule those appointments, and then you can see your kids from the time they are 7 or 8 years old or younger, all the way up until they're in college and beyond. So it's great to see you.
Good to see you too.
It's go time, people. We all have a story to tell. So let's come together to laugh out loud, to share some hope and joy, all on my new show.
The Jennifer Hudson Show premieres September